this is Sabela Carballal. I'm here on behalf of all authors from Hospital Clinic Barcelona to explain our paper entitled Prevalence of adenomatous polyposis in a fecal immunochemical test-based colorectal cancer screening program and risk of advanced neoplasia during the follow-up. First of all, I would like to remind that current guidelines recommend genetic counseling and also intensive endoscopic surveillance in all of patients with 10 or more colorectal adenomas. That is the lower limit to establish adenomatous polyposis definition. But this recommendation is based on scarce data, so we wanted to investigate the prevalence of this situation in a screening cohort. It means men and women older than 49 years old without personal or family history of colorectal cancer. And the other aim of our study was to investigate the risk of advanced lesions during the follow-up of these patients. So we retrospectively include all of participants in our screening program in Barcelona from 2010 and 2018. With a positive test who underwent a screening colonoscopy in which 10 or more colorectal adenomas were detected and further underwent surveillance until 2018. We exclude patients with serrated polyposis or total colectomy after diagnosis. So the first result of our work was that the prevalence of adenomatous polyposis, it means 10 or more colorectal adenomas, in our cohort was 2.2%. And the second result was the prevalence of hereditary syndromes. The most part of patients with clinical suspicion have a genetic testing, and only 2 patients have a pathogenic genetic variant in a gene related with adenomatous polyposis. So the prevalence of hereditary syndromes in our population was 3.3%. Discarding these 2 patients, we investigate the risk of advanced neoplasia and advanced colorectal cancer during the follow-up, and we saw that 3-year cumulative incidence of colorectal cancer was only 1%, and the 3-year cumulative incidence of colorectal advanced neoplasia was 16%. Interestingly, the most part of patients who develop advanced neoplasia during the follow-up have advanced adenomas at baseline, and advanced neoplasia during the follow-up was mainly detected at first surveillance colonoscopy. Beyond this first surveillance colonoscopy, the risk of advanced neoplasia during follow-up was progressively decreasing over the time. So with these results, we conclude, first of all, that in average risk population, the risk of advanced, in average risk population who participate in a screening program, the prevalence of adenomatous polyposis is around 2%, but the most part of cases seems to be sporadic, and hereditary syndromes seems to be very rare in this population. And second, we saw that we think that the risk of post-colonoscopy colorectal cancer in patients over 49 years old among average risk population without hereditary syndrome is very low, and the risk of advanced neoplasia is considerable, but is mainly detected at first surveillance colonoscopy. So we think future research should focus in better establish the intervals for survey these patients, maybe relaxing these intervals and based the recommendation on the findings of the colonoscopies as we do in patients with sporadic adenomas. Thank you very much for your attention.